Hello everyone, Namaste. I'm Dr. Jayashree C Shanbal and I'm Professor of Language Pathology and Head Department of Speech Language Pathology and also the Chairperson of the Autism Spectrum Disorders Unit at the All India Institute of Speech and Hearing, Mysore. Today, let's dive into a very important topic called as Autism Spectrum Disorders. As we all know, autism spectrum disorders is a neurodevelopmental condition which has deficits in three major areas such as social communication as well as stereotyped repetitive behaviors. This condition is called as autism spectrum because we often do not see that these children form a homogeneous group. There is a lot of heterogeneity in this condition in terms of the type and severity. So it is possible that you see that some of the symptoms are seen while some others might be present in very less severity. Also, the traits that I just mentioned, the triad traits, may not be present in all of them. So what kind of deficits do these children have? You will see that often children with autism spectrum show lack of socialization skills, lack of social smile, poor eye gaze movements, and poor social interaction, which means you'll see that they are not even interacting or mingling with their own peers and their family members. They always seem isolated and aloof. The other important aspect is with respect to communication. These children often have problems in communication, not just in speaking, but also non-verbal communication. Now, what are these non-verbal communication? Non-verbal communication includes facial expressions, your gestures, and also your body languages. So most of the time what we do is we use both our speech as well as our non-verbal communication to communicate something to the other person. But children with autism, you will find that they can have problems even in non-verbal communication. Developmentally also, it is often seen that most children achieve their social smiles very young, that is less than 1 month period. But often children with autism spectrum disorders do not achieve their social smile or it is much delayed. Their speech, which is supposed to be one meaningful word at the first word stage, that is at the age of 12 months or 1 year, is delayed in children with autism spectrum disorders. The other thing that we should discuss is with respect to the stereotyped repetitive behaviors. So many times children with autism spectrum, you will see that they are trying to bang their heads or they're often trying to tear the newspapers or papers. They enjoy those sounds. So you might see that some of them could also be behavioral issues, while some of them could be self-injurious issues as well. Sometimes these children also could have sensory issues which can turn out to becoming behavioral issues. So apart from that, you will see the major complaint that comes from the parents is that the child does not eat certain kind of food. The child does not wear certain kind of clothes. So this is an indication that probably the child has some kind of a sensory processing issues. Sensory processing issues could be hypersensitivity or hyposensitivity. So this can be seen for their hearing, that is auditory stimuli, seeing, that is their visual stimuli, and texture or feeling, that is their tactile stimuli. Just to give you an example, it could be seen that children with autism do not like to hear certain kind of sounds, especially which are those of the high frequencies, like the one from the cooker noise or the mixie noise and so on. With respect to visual, you will see that they do not like certain kinds of lights. Some of them will prefer staying in the light dark lights. Some of them will prefer to be in the dark room, while some others seem to show agitation when they are put in dark rooms and the light is completely lit off. With tactile, you will see that children with autism do not like to wear certain kind of clothes. And it is often seen that woolen clothes or jute clothes are something that they find a lot of difficulty and irritation to wear. So these are some of the examples for sensory issues. So apart from that, what is the most important question that parents have is, what could be the cause of this kind of autism spectrum disorders? So clearly to say, many parents think that they are to blame because they are not able to give time. But however, this is not the cause for autism. It is seen that from most research, autism could be caused because of a genetic condition underlying the neurodevelopmental disorder. So it need not only mean that it is hereditary, but there could also be mutation of the gene causing the condition. And there have been certain causal risk factors that have been seen in certain children with autism through a retrospective study, wherein they have seen that the mothers were probably having some kind of a medical or a significant history with their prenatal, natal or postnatal period. However, it is not a direct relationship to say that only these conditions cause autism, but it could cause any other kind of neurodevelopmental condition as well. So this is not really caused entirely by the environmental, but it is more genetic. But of late we are seeing a lot of epigenetic studies, which means that from the environment as well, if there is no stimulation, or if there is lack of stimulation, or there is lack of exposure to the child, this can actually exacerbate the condition of autism, though they may not be direct causal factors. So this way, we understand that autism spectrum disorders in a nutshell is a neurodevelopmental condition with deficits in social communication and stereotyped repetitive behaviors. And also to reiterate, the causal factors are more directed towards being genetics as per the studies that we have found recently. Thank you.